Hello, Dr. James Bogash, expert in health and longevity, and as the author of Migraines and Epilepsy, How to Find Relief, Live Well, and Protect Your Brain. This particular article really rings true, and forever my frustration has been with epilepsy patients that there's never an approach to heal the brain. The first and only approach is to control the seizures. While that's important, merely controlling the seizures does not fix the underlying problem. All you've done is numbed the brain cells enough so that one brain cell doesn't communicate with another one. That's not a fix, that's a band-aid. And that's why so many people with migraine or with seizures, epilepsy, continue to have problems for years, and things like cognitive decline are on the list of problems down the line. And even then, some 30% of people have what's called intractable epilepsy, where no medication seems to help, and sometimes those people end up with things like surgical implants or surgery to remove portions of their brain. And yet, there's a long list of things that have been shown to help with seizures, including intractable epilepsy. So worst case scenario, when medications aren't helping, adding certain things helps above and beyond that when the medications are not. And yet these are not typical recommendations in the epileptic community. Epileptologists, neurologists are not typically recommending these different approaches. There are lots, but I'm just going to mention 7 of them. But at the top of the list has to do with this particular article on exercise in epilepsy. And they looked across multiple studies, including 331 patients, and they found that exercise improved quality of life. It increased psychoaffective, this was like basically things like depression, their overall emotion and how stable they were. Neurocognitive function, so thought process, was all improved by exercise. The reduction in seizures were there, but it was not considered significant. But it was obviously very good for the brain. Then, if we throw in other things, then the chance of significantly impacting how much seizures play a role in your life just goes up. So, top of the list is ketogenic diet. This should be one of the first recommendations, not the last when everything else has failed. It was around long before medications. The data continues to support the use of ketogenic diet. I've covered this a lot in previous videos, not going to go into it in detail here. Also, DHA, part of the fish oils, has been shown to lower seizure rates. Vitamin D. Most anti-epileptic drugs, AEDs, actually harm bone density. So for that reason alone, people should be taking vitamin D. But vitamin D independently has been shown to have an anti-seizure effect. Obstructive sleep apnea. So getting a sleep study, and if you have obstructive sleep apnea or even central sleep apnea, use a CPAP. There's a huge number of people with epilepsy who have sleep disordered breathing, and the brain not getting oxygen is obviously a problem. Gum health. This probably ties more into inflammation, but periodontal disease has a direct relationship with seizure frequency. Another simple one is melatonin. Melatonin's a very powerful antioxidant of the brain, and 2 things that play a huge role in seizures are both inflammation and oxidative stress. So you start addressing inflammation, like maybe you have some gum problems or teeth problems, and then melatonin as a powerful antioxidant in the brain. It just becomes a no-brainer. An 8th little bonus on there is magnesium. Magnesium has been shown to help with a lot of different things, but also the brain and seizures. So if these have not been recommended to you by your either neurologist or epileptologist, then maybe it's time to find a new one, because these are ones that have been shown in the medical literature to be helpful and without a downside to them, like numbing you up or affecting your cognitive function. As always, I'll post a link to this particular study on the exercise in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.